Well, welcome everyone, and thank you for joining us for today's town call on healthcare coverage options for arts and entertainment workers. I'm Ann Del Castillo, Commissioner of the Mayor's Office of Media and Entertainment, and I'd like to thank our esteemed panelists, Renato Marinaro, the National Director of Health Services at the Actors Fund, and Marielle Kress, Executive Director of NYC Care at NYC Health Hospitals. I also want to thank the team at the Mayor's Office of Media and Entertainment, Aaliyah Jones-Harvey, Head of Industry Initiatives, and our programs and nightlife teams for organizing today's event, and as well as for their ongoing work to facilitate open and productive dialogue between New York City's creative community and city government. Just to give you a sense of today's program structure, after a few introductory remarks, we're going to go straight into panel presentations. Starting with the Actors Fund and then moving to NYC Care. And then we will have Q&A. And so throughout the session, if you would submit your questions through the Q&A function. And then following the presentations, our theater director, Carla Hook-Miller, will read through the questions that were submitted through the Q&A following the presentations. The program is being recorded and will be made available on our site. If for some reason we run out of time and don't get to all of the questions, we will be saving those questions and making sure that those get answered after the session. So as I said, before I begin, I just want to take a moment to introduce our work at the Mayor's Office of Media and Entertainment. Some of you may know us primarily as the film office, but in the last 4 years, our mandate has expanded significantly. Our office is charged with supporting New York City's creative economy, film, television, theater, music, advertising, publishing, digital content, and nightlife, where many of our creative movements have been born. I think we would all agree that New York City's creative economy is key to the city's revival. Before COVID, these sectors represented 150 billion in economic activity and 500,000 jobs. And I know that many of you here have been really hard hit by the pandemic. When COVID hit, our agency went from cheerleader to crisis counselor, speaking with many of you and your colleagues in the industry. We've really been working since last March to try to get the creative economy up and running as quickly and safely as possible. We've been primarily focused on 4 activities: ongoing communication through town calls like this, surveys, conference calls, sharing information via our newsletter and website, advocacy, fighting for financial assistance, unemployment and benefits and grants, marketing and promotion of things that have been able to continue through the pandemic, and supporting businesses and organizations through media sponsorship and public awareness campaigns like virtual NYC curator collections, NYC Loves Bookstores, Gen Arts NYC, and other programs. And then creating programs, partnering with our colleagues in city government to create programs that celebrate the creative community as well as connect them to critical supports. So we worked with our colleagues to set up outdoor dining, a program called Music for the Soul, where we employed local musicians to do musical performances for healthcare workers, off-Broadway in the Boroughs pop-ups, where we did off-Broadway performances throughout the 5 boroughs. And right now we have New York Music Month extended play, which is going on for 6 months through June with events to help support our New York City music community. We recently announced Curtains Up NYC, which provides free webinars and one-on-one counseling for those organizations that will be applying for the Shuttered Venues Operators Grants, otherwise known as Save Our Stages. And we've also launched Open Culture, whereby we hope to support live performances in outdoor public spaces as a source of revenue and jobs for arts and cultural organizations. All of that said, we know that we still have a lot to do to support the recovery of New York City's creative sectors. We have seen throughout the pandemic the resilience, the creativity and innovation and collaboration that keeps the city moving forward. We also know that access to healthcare is a critical part of that recovery. And so without further ado, I'm pleased to present the first panelist, Renato Marinaro, who will talk to you about the work that the Actors Fund is doing. Renato?
Thank you so much, Anne and Aaliyah and everybody at the mayor's office. This is the amount of work that you guys have done is absolutely incredible. So hats off to everything that you have done and are going to be doing going forward this year. My name is Renata Marinero. I'm a social worker. I'm the National Director of Health Services for the Actors Fund. I have worked in different healthcare settings in New York City, including hospitals and rehabs and nonprofits. So I've seen how the healthcare system works. And I've seen how the health insurance system can be an obstacle to getting care. So our goal at Health Service is really to help people understand the system, create educated consumers, enroll them, and turn everybody into a health insurance ninja. That's what I'm here to do. So that being said, if you'd like to contact me, you can see my email address here. It's rmarinero@actorsfund.org. I'm going to talk a little bit about what the Actors Fund does and how the Artist Health Insurance Resource Center can help right now. And then I'm going to give you a little taste of one of our webinars. I noticed that we already have a question in the Q&A about income and the essential plan, and that made me very happy because I can answer that question. And these are the kinds of questions that we answer during our webinars. So next slide, please. So the Actors Fund is a nationwide human services organization that fosters stability and resiliency and provides a safety net for performing arts and entertainment professionals over their lifespan. Never more necessary than now. You can find out about the Actors Fund at actorsfund.org. We have 4 main service areas: social services and financial assistance. They provide counseling and support and online support groups on all kinds of topics, including financial wellness. We also currently have grants to help people who have been affected by COVID-19. We have the Career Center, which helps people find meaningful sideline work. Right now, they're offering a lot of COVID-19 related webinars, such as how to job search during a pandemic, as well as their other regular webinars on topics such as how to use LinkedIn. Health and health insurance is my department. As I said, we help people understand and navigate the system and enroll in health insurance. We provide weekly webinars, we create educational materials, we counsel you on what your options are, and we help you enroll insurance. In insurance, we also have a primary and specialty care health center in Times Square that I'll talk about a little bit at the end. And then the Housing Resource Center helps people, they provide seminars on affordable housing options, who is eligible and how to apply, but they also develop affordable housing in New York City and other parts of the country. Next slide, please. So how has our community been impacted by COVID-19? I have a feeling that you can all speak to this. The entertainment industry generates more than $10 billion in economic activity in New York State and is central to tourism, travel, and hospitality. Tens of thousands of workers have seen their livelihoods disappear overnight. Union health plans have been devastated with no one paying in. One of the problems with this system is that it leaves entertainers at a disadvantage over other workers, returning to more conventional jobs where their coverage can start immediately. So for many people, even when the industry gets going, it's going to take them 6 months, a year and a half, maybe even 2 years until they can get their health insurance back. Plus, members continue to owe union dues even though they aren't eligible for health benefits. Next slide, please. So how can the Artist Health Insurance Resource Center help? Well, first of all, we have a lot of online resources, including tutorials and cartoons and archived webinars. You can find them all at actorsfund.org/AHIRC. So we have some pretty cute little cartoons. They're 3 minutes long, and they explain Medicaid and Medicare and how to get discounted dental services and how to save money on drugs and all different kinds of stuff. We also archive our weekly live webinars. So we do have live webinars every Monday. It's Welcome to Medicare for people that are just getting into Medicare, people who are 65 and over or disabled. We also have every Thursday, Every Artist Insured. And I'm going to give you a little snippet of every artist insured during this presentation. You can RSVP for any of these webinars at actorsfund.org/workshops. In fact, you can see all of our workshops for our different departments at actorsfund.org/workshops. Next slide, please. So this is just a screenshot of what you're going to find at actorsfund.org/AHERC. So like I said, the cartoons, the archived webinars, and then other resources, including tutorials on how to find help with Medicare costs, how to find a provider using marketplace plans, etc. Next slide, please. We have individual, unbiased, comprehensive, and free counseling from certified navigators. Our people have been doing this for many, many years. They're extremely knowledgeable, and they will help you sort through all of your options. Again, it's free, it's unbiased, and it's very comprehensive. One of the really cool things about the Artist Health Insurance Resource Center is that we have a very broad overview of what your options are. So whereas if you went to an individual insurance agent, they might only know about private insurance options. Or if you went to somebody who works for a program, Medicaid or one of the other programs, they might only know about that option. We have a very broad overview. We can explain all of the options: private insurance, marketplace coverage, Medicaid, the essential plan, Medicare. We've got it all covered. In order to get assistance, we ask that you complete a form online. You can find that form at actorsfund.org/AHIRC. So we are busy and we need your help in helping us help you. So if you can fill out that form and not call us, but fill out that form, that would be really great. Then we will get back to you within 2 business days to schedule an appointment for an individual consultation, and we will help you enroll. We also have funding through Broadway Care's Equity Fights AIDS for insurance premiums. So you do have to meet certain eligibility guidelines in order to be eligible for this funding. You do have to be losing union or industry job coverage. But if you do meet the eligibility guidelines, we can help with some financial assistance for your insurance premiums. Again, in order to access this, you would have to go to actorsfund.org/AHERC and fill out a little form. Next slide, please. We do have the Friedman Health Center for the Performing Arts, which is in partnership with Mount Sinai Doctors. This is a health center for people in the performing arts. We have internal and family medicine doctors, really, really wonderful doctors, a gynecologist, a dermatologist, and a podiatrist. We are located in the heart of Times Square. We're open late. You can make an appointment through ZocDoc. You can also see the phone number here, 212-930-7300. We take a lot of different types of insurance. That was very important to us when we started this 3 years ago. So we take union plans, employer plans, workers' comp, Medicare. We do take the Blue Cross Blue Shield Essential Plan, and we take several marketplace plans. We also offer subsidized visits. Again, this is a program through a generous grant from Broadway Care's Equity Fights AIDS, and it's also supported by the Lab BioReference. So if you're eligible for these subsidized visits, you would be paying $40 for an office visit, and your lab work would be free. This is for people in the entertainment industry who don't qualify for programs like Medicaid and the Essential Plan, and who have made a certain amount of money in the industry over a period of time. Next slide, please. So the rest of this presentation is going to be a little mini Every Artist Insured webinar, so you kind of get an idea for what your health insurance options are. When you're enrolling in marketplace coverage or Medicaid or the Essential Plan, if you live in New York, you're going to go to nystateofhealth.ny.gov. That's your marketplace website. If there's anybody on this call that lives in New Jersey, you're going to go to nj.gov/getcoverednj. And again, if you need help, you're going to go to actorsfund.org/AHERC and fill out that form, and we'll have a navigator contact you within 2 business days to help you. Next slide, please. You can enroll right now, which is pretty awesome. So normally open enrollment is from November 1st to January 31st of every year. That's for New York and New Jersey, also FYI California. In many other states, it ends December 15th. But in New York and New Jersey, you can enroll for 3 months out of the year for open enrollment. Because of COVID-19, we've had an extension of this open enrollment period, which means that if you live in New York and New Jersey and many, many other states in this country right now, you can enroll through May 15th. Now, for those of you who are losing your coverage after May 15th, don't freak out. There is a special enrollment period of 60 days for certain life events like the loss of job coverage or union coverage, moving, getting married, turning 26 years old. So if you're about to lose or if you're going to lose your coverage after May 15th, you have 60 days from the date of these life events to get other coverage. It's known as a special enrollment period.
Next and Renata, not to jump in, but of course, if your income is low enough to qualify for Medicaid, you can enroll all year round, regardless of COVID-19.
Yes, absolutely. So if your income is low enough for Medicaid or the Essential Plan, or if you're putting a child on Child Health Plus, or if you're getting small business insurance, you can enroll at any time of year. Next slide, please. So what are your options right now? What's this kind of overview that I was talking about? So if you're losing coverage through a job or union, you have the option of COBRA. You can also buy insurance directly from an insurance company. I am not going to recommend that for 2 reasons, and here's why. For one, you're more likely to get junk insurance if you buy directly from an insurance company. Junk insurance is not permitted in New York and New Jersey, but people get slammed with emails all the time and sign up for stuff that is not regulated by the Affordable Care Act. And so you're more likely to have that happen if you go directly to an insurance company. Also, insurance companies are not going to make changes to your premiums based on your income. So they don't care what you're making every month. They don't care that there's a pandemic or that you just lost your job. They're going to want that same premium every month. Whereas if you go to the marketplace and your income changes, you can let the marketplace know, and they will then change your premiums. You may also be eligible for Medicaid. And if you're a New York resident, you may be eligible for the Essential Plan as well. Next slide, please. So how do you figure out your income? We get this question all the time. It's so hard to figure out your income when you're in the industry and there's not a pandemic. So it's even harder when there is a pandemic, right? There's really 2 ways to estimate your income. I'm going to talk about both ways. You're going to use whichever way works best for you. So what you should know about the marketplace is that they want to understand what your 2021 modified adjusted gross income is going to be. That's what they're trying to figure out. So you can either use your most recent tax return if it's within 10% of what you think your 2021 income is going to be, or you can build your income. So for the first option, if you think that your most recent tax return, which for most people is 2019, is going to be, or if you think 2021 is going to be within 10% of what line 8B is on your 2019 tax return, then you can use that number. That's line 8B of 2019 is your adjusted gross income. You're going to add in any non-taxable Social Security benefits, tax-exempt interest, capital gains, dividends, and foreign earned income. And that creates what's called modified adjusted gross income. So you can do that. And if that's the case, that's the easiest way to do it. Next slide, please. Now, most people's 2021 income is going to be nowhere near 2019, right? So how do you do that? What do you do? You're going to estimate your 2021 income based on all of the following, and you're going to use only what you know you will receive. So we see a lot of people kind of doing a sort of wishful thinking of like, well, I'm really hoping that everything gets back to normal by September, and by the end of the year, I'm hoping that I'm going to make 30,000, for example. That's actually not how you want to approach going on to the marketplace. The marketplace wants to know at this point in time, using what you know you're going to receive, what do you estimate 2021 to be? And when that changes, and hopefully it will change, but when that changes, you can go back into the system and change or update your income. So for now, if you're only receiving unemployment income, you're going to add up the total number of weeks of gross unemployment income you will receive in 2021. If that's all you're receiving, that's all you're going to put in. And I'm going to talk about pandemic benefits in just a second. So just hold off on that for 1 second. Now, if you're somebody that's just receiving unemployment and then later in the year you start working, then you're going to go back into the system and add in your income from your self-employed work or your W-2 work. But it's totally fine if you're just receiving unemployment income to just put that in now. Now, if you're somebody that has started working again, you've got a W-2 job, you're going to put your gross W-2 income for the year into the system. If you've been doing some self-employed work, maybe you've been teaching voice lessons via Zoom, you're going to add up your net self-employed income. Net means minus business expenses. So the easiest way to do that is to use the average of the prior 3 months. That means you add up your self-employed revenue, you deduct business expenses, you come up with one number for the last 3 months, you divide that number by 3, that gives you the average for the last 3 months, and then you multiply that by 12. And that's how you can estimate any self-employed income that you've got. You're going to add in any other gross sources of income like interest, dividends, rental income, residuals, anything that's going to show up on your tax return needs to be included. Okay. So in terms of pandemic income, you do not need to include the $1,200 check or the $600 check. Those are automatically excluded. Okay. And since we're only talking about 2021 right now, people are getting 11 weeks of $300 a week benefits, right? You're going to add in the $300 a week benefit only if your income is less than $25,520. Okay. That's if you're a New York resident. If you're a New Jersey resident, it's less than 17. I'm sorry. Oh, I'm a little worried that I just messed that up. You're going to add in the $300 a week only if your income is above $25,520. You're not going to add it in if it's below $25,520. So let me just reiterate. If you're getting the $300 a week, you're going to add that into your income estimate. If your income is above $25,520 for one person, you're not going to add it in if it's below that. In New Jersey, you're going to add it in if it's above $17,609. You're not going to add it in if it's below that. Why is that? Because New York allows you to exempt your $300 a week from your income estimate if you're either eligible for Medicaid or the essential plan. Since New Jersey does not have the essential plan, you don't have to add it in if you're eligible for Medicaid in New Jersey. All right. Next slide, please. Who's eligible for Medicaid? So if you're under 65 years old, there's 2 ways to be eligible for Medicaid. And just FYI, New York is a Medicaid expansion state, as is New Jersey. You can either be eligible for Medicaid if your annual income is below $17,609 for one person, or $23,792 for 2 people. Or you can be eligible for Medicaid if your income in the current month was below the monthly income limit. And the monthly income limit is $1,468 for one person, or $1,983 for 2 people, regardless of your income for the rest of the year. So New York uses 2 different ways to screen for Medicaid, either annual income or current month's income. And you can use whichever way works best for you. Next slide, please. And just a word about Medicaid, it is free comprehensive insurance. So there are no premiums or deductibles, and there are very few copays. The only copays that you have are $1 or $3 for medications. So Medicaid is a very comprehensive, almost free program. The Essential Plan provides comprehensive health insurance as well. The premium is $20 a month. There are no deductibles. The copays are low, so $15 for primary care physician, $25 for a specialist. You can add dental and vision for an upcharge. New York is the only state outside of Minnesota that has the Essential Plan. In order to be eligible for the Essential Plan, your income has to be below $25,520 for one person, or $34,480 for two people. So the Essential Plan looks at your annual income. They don't look at your monthly income like Medicaid. So there's only one way to be eligible for the Essential Plan, and that's based on your annual income. Next slide, please. If you don't qualify for Medicaid or the Essential Plan, you're going to be eligible for a qualified health plan on the marketplace. And I can't tell you what it's going to cost because it's very particular to your county, your household size, what type of plan you get, the insurance company, how much money, or how much, what your income is. But I can tell you that everybody's going to be eligible for a discounted rate on their premiums if their incomes are below $51,000 for one person, or $69,000 for two people. So if your incomes are below that, you're going to get a discount on your premiums. Next slide, please. There's different levels of coverage. These are called metal levels on the marketplace. So these qualified health plans have different levels. Bronze is the lowest level of coverage. It's the cheapest every month. It's for those people that don't believe in Western medicine and just want to make sure that if something horrible happens, that they have an out-of-pocket maximum. In other words, there's a cap on how much money they owe for medical bills. Silver is the next level up. The deductibles are a little lower. The premiums are a little higher every month. Gold and platinum, you're looking at premiums that are higher. With the platinum plan in New York, you will have no deductible if you get a standard plan. Gold and platinum are for people that make frequent use of the healthcare system. So when you're looking at getting a plan, you're going to take a look at how you use the healthcare system. You're not going to think about, name brands. Name brands are not better. You're going to look at how you use the healthcare system, what your budget is, and what your doctors are in network with. And that's going to help you decide what kind of plan you're going to go with. Next slide, please. If you're uninsured, you have different options, and we're going to hear about this more in just a second. So I'm just going to go through this quickly. But New York is pretty spectacular in terms of how we help the uninsured. Very few other cities do as much as New York City does to help the uninsured get access to healthcare. So there's NYC Care, which you're going to hear about in just a second. There's HHC options. They cover inpatient, outpatient, and drug costs for the uninsured. You can also get discounted or free prescription drugs at Needy Meds. Needy Meds is a database that just shows you all of the pharmaceutical assistance programs out there. So drug companies get big tax breaks for giving their drugs away for free to people who are uninsured and have lower incomes. That's what Needy Meds does. It compiles all those programs. You can also compare drug prices at different pharmacies in your area at goodrx.com. So when you go to GoodRx, it's actually searching different pharmacies in your area and comparing the retail cost. You can also print out discount coupons there. Next slide, please. So I'm going to wrap up here with the New York State COBRA subsidy. I just want you guys to know that there is such a thing as the New York State COBRA subsidy. It provides a 50% subsidy for COBRA premiums for those losing coverage through their entertainment union health plan. There's a 12-month lifetime max on that. They do look at your prior month's income, and it has to be below roughly $2,500. Now, this program is currently on hold, we are requesting an extension and expansion of funding and an increase in the income limit, which hasn't changed in many years. Next slide, please. So if you want to advocate for this program, please do get in touch with the Senate Majority Leader or the Assembly Speaker. You can see their information here and let them know that this is essential to the survival of our workforce in New York City. It reduces healthcare costs for the state. It's really important that this program get refunded and expanded. And that is it. Thank you everybody so much. I'm going to hand it off to Marielle, who will talk to you more about NYC Care.
Great. Thank you so much, Renata. It's really fantastic, the assistance that you're providing to everybody. I want to tell everyone a little bit about NYC Care, which is a healthcare access program for people who are ineligible for or who can't afford insurance based on federal guidelines. So that means that the premium, like Renata was talking about, is more than 8% of the person's income. So I'll talk a little bit more about the program. Next slide, please. So just a little bit of a backgrounder on New York City Health and Hospitals and how the program was created. So New York City Health and Hospitals is the largest public healthcare system in the United States. We provide inpatient, outpatient, and home-based services to more than 1 million New Yorkers every year at our 11 acute care hospitals and 70 locations total, including through our Gotham Health Network, which is the largest community health center network in the United States. We've long been committed to providing care to New Yorkers regardless of their immigration status or ability to pay. And so a couple years ago, the mayor really wanted to make that promise into a more formal program and created NYC Care through his Guaranteed Care Initiative. And so we know that hundreds of thousands of New Yorkers are uninsured. We know that even more are uninsured now because of the pandemic. In New York, we believe that healthcare is a human right and that folks should be connected to access to care regardless of their income and immigration status, like I mentioned. And it's even more important, obviously, now with the pandemic and all of the downstream effects that are created by the pandemic. So I think, the takeaway from Renata's message is if you are likely eligible for health insurance, if you've been enrolled in health insurance in the past, you should really go to her and seek help from the Actors Fund. There are other options that I list here. Metro Plus is one of the products on the marketplace that Renata was telling you about. That is the publicly owned health insurance product in New York City and provides all of the different products and plans that she was talking about, from Medicaid to the Essential Plan to the Marketplace. And they also have navigators who can help you go through the New York State of Health and pick the right plan for you. Or you can call 311 or text Covered NYC to 877-877 to be connected to a Get Covered NYC specialist. And those folks will also help you go through the New York State of Health if you are likely eligible for health insurance like Medicaid or the Marketplace or the Essential Plan. But we know that there are lots of people who are ineligible for health insurance in New York City or who can't afford the premium if it's more than 8% of their income. And so that is where NYC Care comes in. So I'll talk a little bit more about that. Next slide. So NYC Care is a healthcare access program that provides low or no cost healthcare services through the New York City Health and Hospitals system, like I just mentioned, to folks who are ineligible for or who can't afford health insurance. And the program is really focused on access to primary care. So we want folks to have a primary care provider that's assigned to them, that they know, that they develop a relationship with. There's really robust access to pharmacy services 24/7. So both within our facility pharmacies and also through a contract with CVS at select locations across the city. And then we also have a 24-hour contact center and a membership card where the fees that you'll pay if you enroll in the program are listed for ease, and also a lot of member materials as well. And it's really important to note that this program is not insurance. And so we really want people to be enrolled in insurance if they are eligible for it. And this is the program really for people who are not eligible for insurance. If you have NYC Care, you can't go to outside hospitals or clinics. The care is really being provided within the system. And so I really encourage folks, if they think they might be eligible for Medicaid or the marketplace, to contact Renata. And I have lots of ideas about how we can connect to direct folks who are not eligible for health insurance over to NYC Care. Next slide. So I mentioned this a couple different times. We actually help people go through the New York State of Health as well, if you want to seek care at New York City Health and Hospitals. So we help folks go through that process. If they're found ineligible and they're a New York City resident for at least 6 months and live in the 5 boroughs, then they can enroll in NYC Care. Next slide. The way that folks get connected to the program is by calling our hotline, 646 NYC Care. We used to have a lot more in-person assistance at our facilities, but we've taken a lot online and telephonically. And so if you call the number, you'll be connected to a financial counselor who can help you go through the New York State of Health process, see if you might be eligible for insurance. And if not, enroll you in NYC Care and make you a care appointment to see your primary care provider, who can also refer you to all of the specialists that are available through the health and hospital system. And Renata was also mentioning H&H options. NYC Care has largely replaced the program, but H&H Options is also available as a financial assistance program to people who might live outside of the 5 boroughs in Westchester County or in Nassau County. And also H&H Options is there for people who might be underinsured. So in many cases, there are out-of-pocket costs, like Renata was talking about, for people who are enrolled in a marketplace plan. And options can act as a wraparound to help people afford those fees. So it's another option. If you are enrolled in insurance, you can come to us and we can help you get connected to that program. And it also can provide some basic dental services if that's not provided to you through your insurance plan as well. Next slide. So the enrollment process, I touched a little bit on that. Folks call the phone number, get connected largely telephonically with a financial counselor, and are screened for insurance eligibility. And the application process can be challenging and tricky, and Renata's navigators are likely very equipped to help you work through that. And there are lots of other organizations throughout the city that are also working with people to help them navigate the system and the process. And the process really does require to produce a number of pieces of documentation, like Renata was saying, to illuminate what your income is and your household size and who you are, to really be able to verify your identity. But if folks don't have those documents, our financial counselors are really trained and are specializing in helping people get through that process without that documentation. So we know a lot of people, come from other countries and may not have identification in this country. So working with people with passports from their home country, or all different kinds of things, even, sort of an attestation or a letter that declares their income or who they are. So don't be discouraged if you don't have any of those pieces of documentation. We want to work with you and we want to help you get through the process. Next slide. So like I mentioned, our facilities are all across the 5 boroughs, and on our website, which I think we'll share in the chat, there's a list of our locations, so you can take a look and check that out. Next slide. And I just want to take a moment to talk about how the progress of the program has unfolded. We yesterday announced that we've enrolled over 50,000 New Yorkers. I receive a report once a week about how folks are hearing about the program, and the number one way is really word of mouth. So folks are telling their friends and family. And our members have really taken advantage of the low or no cost care. So we've seen 250,000 primary and specialty care appointments, including 75,000 telehealth appointments since the beginning of the pandemic. So lots of different options for people. If they're not necessarily comfortable coming to us in person, we can work with you over the phone. And, you know, our members really have experienced chronic conditions at a higher rate than the general population. And we have seen great control with those chronic conditions for after people have enrolled in the program and are really able to access that care for the first time. Next slide. You may also have heard about us on the subway and all throughout the city. We have beautiful public awareness messages and are working closely with community and ethnic media as well. Next slide. And we also have, as I mentioned, 30 community-based organization partners who help folks all across the city get connected to the program, help them understand what the enrollment process looks like, and help folks enroll. And like I mentioned, many of these partners are also navigators or certified application counselors themselves and can also help walk people through the New York State of Health application process. And these are our partners in Queens and Manhattan. And the next slide are our partners in Brooklyn, Bronx, and Staten Island. And collectively, these organizations speak 30 different languages. And they're all listed on our website. So please feel free to take a look and contact one of them. And then I'll just end on a note that is an amazing story of one of our members who came to this country in 2019 after undergoing a kidney transplant in his home country. And he unfortunately contracted COVID in April of last year. And when he tells the story, he says that he would not have gone to the hospital had he not been connected to the program previously. And, you know, was very, very sick and in the hospital for 21 days, but recovered to tell his story. And so I think, you know, the suffering and the challenges that we're facing as a city from the pandemic are immense, but there is hope and there are options and there's support out there. And I really encourage folks to seek our help in getting connected to ongoing insurance and coverage and care as well. And there should be an option for everybody. So don't hesitate to reach out. Next slide. I think that's it.
Okay. Thank you both very much. I know that we have some questions. So Carla, are you there? Great.
Yes. Hi. Okay. I think, Renata, this question's for you about, it's from Elizabeth. Is this information exclusively for actors or everyone in the entertainment industry? I'm a TV film producer director.
Absolutely everybody in performing arts and entertainment. Ushers, dancers, singers, musicians, stagehands, everybody in arts and entertainment.
Okay, great. And Melissa, you may have actually answered some of this, but Melissa's asking, and this is for either of you, that she's concerned about the PUA unemployment, including the extra $600 per week counted as taxable income. Between that and the few small jobs she found in 2020, she fears her income may be above the essential plan. And the unemployment will then cost more than it benefits. And she also has a friend with the same concern regarding her SNAP benefits.
Is it okay if I jump in here? So, okay. So the $600 a week was last year. This year it's $300 a week. So when you're applying, you're looking at this year's income. So she does not have to take the $600 a week into account. It would be the $300 a week, which is currently appropriated just for 11 weeks, as well as any kind of unemployment income, right? So if you are existing just on your unemployment, you're going to take your gross unemployment and add that up. That's probably not going to be over the essential plan limit, which is $25,520 for one person. And so you would not have to add in the additional $300 a week. I hope that's helpful.
Okay, and then there are a few questions about COBRA that might need some clarification. One from Karen, that the state COBRA subsidy that is not funded, and has a too short lifetime limit of 1 year. Has expansion and funding been a part of the overall state conversation? And if not, do we have allies in the city government to forward this? Most theater artists in New York City cannot afford COBRA or insurance under Affordable Care and cannot get sufficient work weeks to continue coverage when it expires.
Great question. So yes, COBRA is expensive. You're paying 100 to 102% of the cost of your premiums. So it is expensive, which is why the COBRA subsidy is so necessary. There's two COBRA subsidies that people are talking about right now. There's the federal COBRA subsidy, which is being debated in Congress. And that is anywhere between 85 and 100% subsidization of COBRA premiums. And then there's the New York State COBRA subsidy that is just for entertainment workers. That program is only for people who are getting their insurance coverage through an entertainment union and then lose that coverage and are eligible for COBRA. I don't know about New York City, but I know that we have allies in New York State government, and it is very important to advocate for this on a state level. So I would encourage you to advocate with the Speaker of the Assembly and the Speaker of the Senate to make sure that this COBRA subsidy gets passed. Now, it would be going forward. So the COBRA subsidy would not apply to anybody who had COBRA last year. It would be for people who are eligible for COBRA going forward. And they're still basically writing the program and looking at ways of changing it, expanding it. So please do feel free to send your thoughts and your concerns and your wishes to the Assembly Speaker and the Senate Speaker.
Great. And Daniel asks, if I'm losing my equity health insurance in June, how early can I start looking for a new plan?
We suggest 30 days prior. Generally not more than 30 days prior to losing your coverage, because if you do that, then you often require a letter of creditable coverage from the insurance company. So 30 days prior is usually a good marker.
Okay, there's a couple of links to advocacy efforts that I will paste into the chat that people have listed here. I think you might want to see if there's more questions that come in. Did such a good job answering everything. Anyone want to enter some questions into the Q&A?
I know there was a question if this was going to be made available. after the session. And yes, just to remind folks that we are going to be posting the archive video on our site, and it will also be available because this is streaming on Facebook Live, and so you'll be able to access it there as well.
Yeah, that should be in there.
All right. Well, it sounds like you covered a lot and people got a lot out of today's session. Are there any last bits that you want to mention before we wrap? And certainly, you know, we're going to be including the links to your sites. And so if there are follow-up that we weren't able to cover here, or if someone wasn't able to get to it, they'll certainly know how to reach you. But if there's anything else that you'd like to, Carla, I hope that's okay, unless you're seeing anything else in the chat.
No, and I just pasted the 2 alerts about the links to things coming up that are probably noteworthy if everyone wants to save the chat, so they'll have a record of that. Be a good idea.
Renata and Marielle, thank you so much for sharing these resources. Oh, there was a whole bunch that turned up. Maybe there was a click.
Oh. Oh, yeah. Okay,
yeah,
everyone.
It's weird. It's like all of a sudden
Okay, so Julie is asking, is there a temporary plan? I lose my coverage end of April, but go on Medicare in November.
Okay, so in that situation, you don't want temporary insurance. You don't want short-term insurance. You want to enroll in a plan. And then when you get on Medicare, you will disenroll in the marketplace plan.
Okay, and someone's asking, let's see, I'm sorry. Marianne, you say you have a particular COBRA situation, but I don't see. Maybe you could type in more information on that. Oh, here. Should I email it or ask it here? Okay, so we'll make sure that in the chat we have your contact, Renata and Marielle's as well. I believe, Kevin, if you could add that in. And then Ari is saying, are the earnings limits based on households totals or whichever is lower, single versus couple?
I'll just answer it for Marketplace, and Marielle can answer it for NYC Care. But for Marketplace coverage, Medicaid, and the Essential Plan, you're looking at household income. Household income is anybody that you pay taxes with. So you need to have anybody that is on your tax return listed in your household income. That does not include roommates. It does not include domestic partners, but it includes everybody else. Even if that person doesn't need insurance, they need to be listed as part of your income.
And the same goes for NYC Care. We're using the New York State of Health to determine the fee scale. So same goes.
Okay. And there seems to be one last question that from Marianne, that I've been on COBRA since December 2019 and it runs out on May 31st. Will it be extended federally?
I don't know of any federal extension for COBRA at this point in time.
Okay. All right, Carla, thank you.
You're welcome.
Q&A. And again, Renata and Marielle, thank you so much for participating in today's panel. You know, I would just say, please know that we're continuing to try to connect you guys to resources. We have a number of resources listed on the MOME website at nyc.gov/MOME. And again, if there are follow-ups from today's session, we're happy to take those and get you the responses that you need. Thank you all. Stay safe and stay strong. Thank you.